Medication adherence is a crucial component in the management of patients with chronic diseases needing a long-term pharmacotherapy. Parkinson's disease is a chronic degenerative disease with complex drug treatment that poses challenging barriers to patient adherence. Despite strides on how Parkinson's disease symptoms are treated in recent years, these neurological disorders remain among the leading causes of morbidity and mortality worldwide. At least part of the problem is that even the most effective drugs will not work if people do not take them. Yet, both in routine practice and clinical trials, poor medication adherence is a problem that continues to hamper progress against this chronic disease. When it comes to clinical trials in chronic diseases, 1/3 of phase 3 participants are non-adherent by the day 100. And across all development stages, 50% admit to not following the dosing protocol. The problem then is not just the lack of effective pharmacological interventions. Rather, the lack of medication adherence is a significant obstacle in the management of Parkinson's disease symptoms and in the interpretation of the clinical trials. Among people with Parkinson's disease, suboptimal adherence to medications ranges from 10 to 67% and is currently measured using different methods, including the use of patient-recorded outcome, the PROs. The PROs are developed to address different contexts and disease. The PROs that are used nowadays in Parkinson's disease were developed to address different contexts and disease. PROs are increasingly being accepted as the main endpoints of clinical trials in health research. The FDA have endorsed PROs as main clinical trial endpoints, as the results measured by these instruments can guide patient care. In 2018, the Non-Adherence Academic Research Consortium recognized the importance of collecting adherence data during clinical trials. This has created a critical need to standardize the assessment of response to drug therapy in patients with Parkinson's disease through accurate measurement of adherence behaviors. Additionally, has created a critical need to develop a PRO that is salient, accurate, and reliable for use in Parkinson's disease clinical trials. The Parkinson's Disease Medication Adherence Rating Scale, the PDMIS, is a PRO that was conceptualized by our study group and designed to measure adherence behavior usually reported by the individual responsible for the management and administration of the Parkinson's disease medication. Under the premise that medication adherence is measured by the extent to which a person's behaviors when taking medication corresponds to the recommendation provided by a healthcare professional, the PDMIS, the Parkinson's Disease Medication Rating Scale, was created based on a conceptual framework designed specifically for the context of Parkinson's disease. The conceptual framework of the PDMIS is composed by 5 dimensions: the patient dimension, the healthcare system, the health system and the healthcare, the social economic, the therapy dimension, and the health condition dimension. It is composed as well by 2 factors: the intentional factor, that's when the patient intentionally do not take the medication. For example, patients with side effects of that medication that intentionally do not take them so that they can avoid that side effect. And the unintentional factor, that is when patients do not take their medication, for example, when they cannot afford them. The conceptual framework of the PDMIS is also composed by 4 phases. The initiation, that's when the patient needs to start the medication as prescribed by the healthcare professional. The implementation, That is the daily routine of taking medications, the discontinuation when patient needs to stop using the medication, and persistent, a behavior that is measured during all this process. The components of medication adherence in Parkinson's disease can be measured by the PDMIS through a set of 24 items, each containing 5 response options, created so that people with Parkinson's disease and their care partners can report which factors make it difficult for them to use the Parkinson's disease medication as prescribed. So our hypothesis with the current study being developed in partnership with Fluminense Federal University and Rush University is that the 24 items of Parkinson's disease medication will appropriate measure the intended construct and assessment objectives and will be meaningful to the Parkinson's disease patients and their care partners that will be the end users of the rating scale. The expected outcome is that Parkinson's disease medication adherence will reflect the intended construct and assess objectives, and that answers will produce valid measurements. Our long-term goal is to conduct successful multicenter clinical trials in individuals with Parkinson's disease and their care partners, and the Parkinson's disease medication adherence rating scale, the PDMIS, will be a primary endpoint that will give precision in the calculated perceived efficacy of drug in clinical trial.